welcome everyone. We are so happy to have you. Whoever's on with us live, thank you for joining us live wherever you are in the world. And for those of you watching the replay, thank you for doing that as well. I hope you will all enjoy this. Jacqueline and I met each other on Facebook. That's how we're on Facebook. We found each other on Facebook and paired up. I loved what she was doing. I think she liked what I was doing. And we just thought we could really share our knowledge and expertise to both our audiences. And it's win-win-win for everyone. So we decided to do this free webinar to really, share our knowledge and expertise and help people. So a couple of technical things. If you're not muted, please mute yourself so we don't hear all your wonderful background noise that might be going on in your house. That's number one. Number two, we want to interact with everyone through the chat box. We are a lot of people on here so far and more are coming, and we really want to hear what you have to say, questions, comments, but I think it's too many people to all be talking at once on Zoom. So I'm going to ask you to send us questions and comments through the chat box. Just for anyone that doesn't know where that is, it's at the bottom of your screen next to participants. There's a little bubble and it says chat. If you open that, you can type in questions, and when you press enter, it puts it out there and everyone will see it. And when Jacqueline's talking, I'll watch the chat box for questions. Jacqueline's going to speak first for a little bit. She has some slides. Then we'll take some questions on what she said. Then I'll speak for a little bit. We'll take questions and then open up to questions. But if all questions could go in the chat box, we'd appreciate that. It'll just make it much more flowing, and that we could concentrate better and not get distracted by everyone's voices. Even though I really wish we could all talk, it would be so fun. But the nature of Zoom with a lot of people is that we can't all talk at once. So that is how we will do it. Feel free to put any questions or comments in the chat box at any point, and we'll take them at different points in the lecture. Any other important things to say now, Jacqueline?
I think that is all good. I can just see there are a couple of people who haven't muted themselves. So just make sure that you're muted if you are not yet.
I'm actually going to go and mute everyone.
Okay.
Also. Okay. Okay, dokes. I think we're ready to start. Jacqueline, could you just introduce yourself and tell us a little bit what you do and why you do it and why you're so passionate about it? And
yes.
Go for it. We can't wait to hear what you have to say.
Yes, I'm going to share my screen. So just one moment. Let me just get my slides up and then I can share my screen. Okay. Okay. So you should all be able to see my screen that says Busting the 3 Menopause Myths. So I'm going to be coming today to talk to you all about, one second, you know what I'm going to do? About sort of what is menopause journey, what is going on, sort of what that means, really getting to the depths of understanding all the things surrounding menopause and menopause time. Hopefully sort of uncovering some of the things of what a modern day menopause journey looks like versus what you perceive or imagine menopause journey would look like. So that's what we are going to do today. Okay. So I am Jacqueline Rose. I am the menopause coach. I am founder and teacher at the Yoga Room. I am a Yoga for Women's Health teacher and a women's health advocate. Yoga for Women's Health is a specific niche of yoga that is really adapted to a woman's body and what a woman experiences throughout her life. I'm on a mission to change the way women understand and experience their health and well-being, about creating awareness of what is going on in their body, strengthening the body-mind connection, and using yoga-based tools and techniques to do it. And specifically for women on their menopause journey, I'm passionate about supporting women through their menopause journey and helping them navigate this time with ease and confidence. Who am I? I'm a wife. I'm a mum of 5. Those 5 tushes that you can see there do belong to me. I'm a yoga teacher. I'm an entrepreneur. I'm a women's health advocate. I am also a multitasker. Sometimes I feel that my life is really that rugby huddle in the mud where it's just dirty and trying to find a way through. I do the household chores. I do the DIY in my house. I also do practice yoga, and I also, as I said, I'm a businesswoman and love collaborating, which is why I'm so excited about today's webinar, because I think collaborating and working with women and supporting women and supporting each other in business is a great way for all of us to shine. So this is a little snippet of sort of my life. I'm going to go now straight into, what do you hear, or what do you think or feel when you hear the word menopause? So I'm going to ask you now to really go into your chat box. And as Rena said, your chat box is in the bottom, and to just put in, what do you think or feel when you hear the word menopause? Oh, someone's already said dread. Thank you. That is perfect. Yes. Anything positive or negative, I would love to know what you connect with when you hear the word menopause. So you can carry on doing that. Write your comments. I want to know what you're thinking. I will say a couple of the things as they're coming about. Yes, no one talks about it. That is exactly one of the problems, that we don't talk about it. It is this word or this stage of life that is filled with shame, embarrassment, secrecy. No one wants to talk about it for the reasons I'm going to discuss in a minute. Night sweats, yes, a lot of symptoms, a lot of physical changes. Great. Sad not to be fertile anymore. Yeah. So we'll talk about that also, because that's part of the emotional journey that you go through, even if you have finished having kids and you don't plan to have any more kids. The fact that that stage of life is over can be something that women really struggle with. So thank you for all your comments. There are some great comments here. Done with that, now what? Yes, looking to the future, looking to post-menopause life, coming to terms with the new stage of life. Great, excellent, amazing things. Everything you've taken, a lot of what you've taken, we're going to address and change the language that you're using. Okay. So how you experience your menopause journey depends on how well you are prepared for it. And if you're not prepared for menopause journey, it can be a little bit like jumping off the edge of a cliff. And I specifically use the word menopause journey and not menopause for reasons that we'll discuss today. So let's get straight into it. Myth number one, I'm going to be looking at 3 myths that we're going to be, the 3 key myths that we're going to be looking at today. The first one is that menopause is only for women 50 plus. And this really gets the crux of why I call it menopause journey and not menopause. So you may not realize that all the random things that you are going through and that you're going to your doctor about, random things that, you know, you can't sleep properly, so you go to a doctor because you want some sleeping tablets to help you sleep, or you're feeling a little bit low, depressed, a bit moody, anxious, so you go to your doctor to get some anti-anxiety tablets or some antidepressants. Or, you know, you have certain aches and pains, you know, you think maybe you've got sort of early arthritis, so you go to the doctor. All those things actually are perimenopause, okay? Menopause is a journey of a long number of years. Women at about 42 to 45 years old enter perimenopause, the journey leading up to menopause. Menopause itself is a date in the calendar year. It is a date that you can look back on. You have to have 12 period-free months, and then you know you are officially in menopause, but menopause is actually a date. Everything until that date is perimenopause, and everything after that date is postmenopause. And you can have lots of different things going on in your body during that time, and it can last anywhere between 5 to 11 years. And it is all about your hormones beginning to change and your body is responding. Okay, so it is not just a random thing that is happening. It is a journey, it is a stage of life, and it can take a number of years. So once we understand that it's not just about being 50 or over 50, but lots of different things are happening in your body leading up, it all of a sudden changes the way you view your health and well-being during, you know, 45, 46, 47, 48. Myth number 2 is that menopause means the beginning of the end. And this was definitely the case about, let's say, women who were going through menopause about 70 years ago. Menopause is not a disease. It is a natural stage of your life. However, women traditionally did not have the opportunities to live full, meaningful lives over the age of 60 because life expectancy was much shorter. The opportunities, the availability, the perception of women, what women were able to do was much, much more limited. As life expectancy has increased, as health and wellness attitudes have changed, as improvements in their own socioeconomic status has changed, life post-menopause is just waiting for you to grab it. So there are so many opportunities now for a woman 55 or 60 plus, that notion that menopause is the beginning of the end, that it is sort of you reach midlife and then it's just a downward flow from then, is really not applicable anymore for the modern menopause journey. If you sort of Google women over the age of 60 and you see the images that are shot back at you, it's just, there are so many opportunities. A woman really, we need to understand menopause as the exciting next phase of a woman's life. This is a quote by Dr. Christiane Northrup, who is the pioneer of changing the way that women view their own health and the way that women's health is perceived. And the menopause really holds enormous promise for transforming and healing our bodies, minds, and spirits on the deepest level. It is not this terrible phase, this disease, this stage that has to be treated always from a medical perspective. It is a transformative, transitional time of life, just like we have puberty at the beginning when we're entering into becoming a woman. Then we have fertile years, or those years in the middle where we that are defined by certain features. And now we have menopausal years that are defined by, again, significant hormonal change. And then post-menopause, where our hormones are at a slightly more balanced level, but a different balanced level, but we are stepping into this new phase of life with wisdom, with understanding, with possibilities, with adventure, with excitement, all those things. And we don't, and that is the way that menopause really has, the language of menopause is changing today because of the possibility and availability of women to be able to do so much more post the age of 60. Our third myth is that menopause means suffering. And this is something that so many women really associate menopause with, which is why all the comments that you mentioned, most of them, a lot of them had very negative connotations. Don't get freaked out by the next slide, ladies. Media is full of all the negative symptoms of menopause. And this is just a handful of them. There are about 75 different menopause symptoms that you can experience. Hot flushes, night sweats, insomnia, fuzzy brain, weight gain, dry skin, low libido, vaginal atrophy, stiff joints, declining bone density, osteoporosis, low energy, changes in period flow and frequency. I will talk about that in 1 second. Feeling low, depressed, anxiety, mood swings, forgetfulness, leaking, all these wonderful things that can happen to a woman during menopause. And that is why menopause has so much secrecy around it, has so much embarrassment around it. The fact that we feel we're aging and the connotations of what aging means and the whole negative language surrounded by aging. I specifically want to talk about period flow, change in frequency and flow, because there is a perception that menopause is your periods slowly, gently become less and less frequent and lighter until one day they just end. That is unfortunately not the way that many women experience it. There is a fluctuation in your menstrual cycle. You can have very, very heavy periods. Sometimes you can have very low periods, shorter periods with low flow. They can come every month. Then you may have a gap for 3 or 4 months. Then you may have one and then another gap for 6 months. It's very, very fluctuating. It's not just this natural, nice, gradual decline. It can be very, very fluctuating. And all of these symptoms, once you understand them, and once you understand your health and well-being changes that can happen during perimenopause and also postmenopause, in the context of menopause journey, it begins to change the way you understand what is going on in your body and how to relate to it, how to engage with it, and how to manage and treat it. So there are a multitude of potential side effects. It really can be defined in 3 clear categories: physical, emotional, and mental or cognitive, which is what Rena is going to talk about later. But if you understand what your body is going through and you prepare it for the next stage of life, you can find many ways to manage, treat, and prevent many of the menopausal side effects. Now, I don't like using the word symptoms very much, because symptoms really relates to menopause as a disease with a diagnosis, like you have, strep or a throat infection, and the symptoms of, fever or having a very bad throat, aches and pains. If the one of the issues has been that we are relating to menopause from this very medical perspective. Unfortunately, doctors have not had your regular local family doctor, even your obs and gynae, your women's health doctor, your gynecologist, may not understand the depths and extent of how menopause can show up. Definitely your family doctor has not had a deep training in menopause management. It's not their fault. It is just the way that doctor training programs are built. In the time in which we're living, I would absolutely not bash the medical health journey, understanding how to treat and manage menopause symptoms, and what a woman goes through. Many doctors are really not educated and trained to the extent of how to navigate this time for women. So let's just go back and recap very quickly the 3 menopause myths: that menopause is only for women 50 and above. Menopause is a journey, and there are different stages to menopause, and therefore the health changes that you could be experiencing as a 46, 47, 48-year-old woman, very, very possibly, most often are menopause related. And I'm not talking even here about women who go through early menopause, because women who are going through early onset menopause may be experiencing a lot of these health and wellness changes much, much earlier on, and they may still have young kids, and they may not realize at all that what they're going through is menopause related. And again, they're going to their doctor, they're getting medication, they're getting treated for specific things that they are experiencing without understanding the whole picture of what is going on in their body. Myth number 2 is that menopause means the beginning of the end, and today we know modern menopause journey is not that at all. So much has changed for what the woman is, firstly, specifically life expectancy, but the opportunities that are available to women. There is so much more available in our postmenopause years, and menopause means suffering. Menopause side effects, the physical, emotional, cognitive, mental health changes that a woman goes through are real, absolutely, but they do not necessarily need to be associated with pain, suffering, and struggle. So what would happen if you change the way you understood and experienced your menopause journey? And this really is where I work with women and help women in changing the way that they don't want to have that typical menopause experience. Either they are in a space of struggle, suffering, pain because they're already experiencing menopause symptoms, or they want to prepare so that they don't have that experience. They've heard about it, they've seen it, and they don't want that for themselves. So I really want every woman to have an empowered menopause journey. And I work with women to be able to achieve that and do that. One of the things that I do, and this is one program that I have, is the Menopause Starter Program, but really I work with women in a very holistic way, looking at 7 areas of their health and well-being. And we look at all the different ways that your menopause journey can show up for you. Hormones, women do not understand their hormones really unless there is a need to. Menopause symptoms, to really understand all the different things that you are going to in the menopause context. We look at stress, sleep, nutrition, movement, and work-life balance. And only when you can really understand that whole framework can you begin to get control of your menopause journey and navigate your symptoms. I'm very much about accountability and implementation. I know so many women who have gone to menopause specialists or have been told they need to change this or do that, and they don't do it because women, we are busy, we have busy lives. But I really feel that I believe in making small, practical changes for big impact. And the changes do not need to be drastic, but you need the accountability and the implementation to help you navigate and make those small changes. And the other thing that I work with is yoga nashik practice. And that is the yoga for women's health, the specific approach to women's health. For me, yoga nashik, this regular yoga practice, is the glue that ties everything up together. It is the glue that supports women throughout their life cycle. So that really is how I work with women. It is how I support women. I have this menopause starter program specifically for that. But in general, my approach really is looking at a holistic 7 areas of your health and well-being, making real accountable, realistic, practical, and implementable changes, and the regular yoga nashik. Now, what I will say is that every woman's menopause journey is different. Every woman experiences it in a different way, which is why these your journey is very unique to you. And you may need, you may be experiencing certain things that other women are not. You may be experiencing your menopause symptoms in a very easy way. Sort of the physical things may be not so impactful, but you may be going through a really difficult emotional journey, loss of identity, figuring out sort of your place, where you want to be for the next few years, how you want, maybe your kids are all leaving the house now and you need to redefine yourself. So your menopause journey can show up very specifically for you, and I tailor make the management of it and getting control of it for exactly what you're going through. I'm coming to the end. I just want to let everyone who is here know that I'm offering you a free mini assessment to start taking control of your menopause symptoms and to have a discussion. We can chat, and I want to be able to provide you with value for what you need in your specific situation. I will be sending out an email later on all about this, so you don't need to worry. But just know that for everyone who has participated, for everyone who has registered, if you're watching this on replay, recorded replay, you also are due, and I will gift you a free 30-minute assessment. The most important thing that I want you to take away from this is that menopause journey is an exciting time of rebirth, metamorphosis, and discovery. And that is not really the language that we associate with menopause. It is a journey that you have to take into the next step of the next exciting phase of your life. And if you start to view it in that context, if you start to understand it as a journey, someone said to me actually this morning in a meeting I was having, I always thought menopause was just a time. Until I met you and until I started hearing you use the word menopause journey, I never realized that it took so many years. And that is why I will only use the word menopause journey. I very rarely use the word menopause, because women, it is the first stage of educating and changing the experience of what you're going through, understanding it as a journey, as a necessary transformative time to step into the next exciting phase of your life. So that is the end of my presentation. I'm going to stop sharing my screen now.
Okay, thank you,
Hi,
Jacqueline.
everyone.
Thank you, Jacqueline. I love your holistic approach to this, first of all. And I just learned a few things.
Great.
Things that I didn't know. I'm gonna ask a question first, and then we'll take questions.
Maybe while you're asking the question, women who have questions can start writing them in the chat.
Exactly. So my question is, and I know this is a very big topic and complicated, and we are not doctors, and we don't pretend to be doctors. But do you want to just address a little bit about what happens in terms of the hormone levels and how it affects brain health, cognition? Like, just tell us a little bit what's going on with the hormones that affects that, if you can.
Okay. So going back to the understanding that menopause journey is a natural stage of your life. It is a hormonal change, a hormonal fluctuation stage of your life. That means that everything that a woman experiences is related to these very potentially drastic hormonal fluctuations. The key hormones that are fluctuating during this time are estrogen, progesterone, and also testosterone. And yes, women, we have testosterone, and testosterone is a super important hormone for women. So as estrogen, progesterone, testosterone are all changing, they impact us physically, emotionally, and cognitively. In addition, and I speak to so many women who are dealing with weight issues during this time, we have the role of cortisol, which is our stress hormone, and the role of insulin. And all these hormones, what worked before won't work now, because as your key hormones are changing, the way they interact and show up with your other hormones are affected, and the impact on brain health but from the fluctuations of estrogen is really, really profound. Estrogen is a super important hormone for women. And a lot of what we go through, a lot of the brain fog, the short-term memory loss, the not being able to focus, concentration, all those things in terms of brain function, cognitive function, that I hear from so many women, and I know, Rena, you do also. I think I've got early onset dementia. Women who are in their early 50s who are saying, you know, I'm not quite sure what's going on. I don't think it's genetic, but I think I'm starting to suffer from early onset dementia, because their brain function is so altered and so changed. And the minute I say to them, you're not going crazy, you're not mad, you're not losing your mind, it's just the hormones, it is the estrogen fluctuations, all of a sudden there is this, there is a sense of relief. I'm normal, this is normal, okay, now what can we do about it? And that begins to change the whole conversation, the whole experience. So thank you for asking. That's really, really important.
Jacqueline, you know what I heard? This is so fascinating. Recently, I just read or heard that estrogen is in charge of 400 bodily functions. So if our estrogen is not in balance, then that really explains why we're not feeling quite right, or why we have brain fog, or so many. Estrogen is related. It's not just estrogen, and 400 bodily functions. That is like huge.
Yeah. And there are estrogen receptors in all the cells. That's why it's so profound. And that's why women start putting on weight. And that's why they notice the changes in so many different parts of their bodies, because there are estrogen receptors in all our cells. So and it's not only the absolute estrogen level that we need to be concerned about, it's also the relative level in relationship to the other hormones, to progesterone and testosterone. So your estrogen could actually be okay. But if your progesterone is totally dropped, all of a sudden it appears as estrogen dominance in the body, and that starts to have effects. So it's not even the absolute estrogen levels that we need to be paying attention to, it's the relative levels compared to the other hormones in our body. So that's why menopause journey can show up in such a profound way in so many different parts of our body.
Yeah, it's so fascinating. It's just so fascinating. Wow.
So if anyone has any questions to ask me, please. Oh, there's a great question here. What is special about yoga nashik during this time of our lives? Thank you for asking this. And is it good for women over the age of 65? Yes. So I will talk a minute about yoga nashik, and then Rena, I think we can move on to you. So yoga nashik is a specific approach to yoga. It takes all the tools and knowledge that yoga has, but it adapts it to a woman's body. And we hear so many times of women and men who get injured during yoga practice. And people don't really understand that, because yoga is meant to be, I know different people have different images of what yoga is, but there is an image that yoga is calm and relaxing, and how can you get injured doing yoga? But yoga often, a traditional approach to yoga can be quite intense, and you can go to a class where the teacher is doing things that, you know, is not appropriate for you, because maybe they are a yoga teacher, maybe they are more flexible than you, maybe they can do different things with their body that you can. Yoga Nashit is about a woman coming today as she is on the mat and what she needs to achieve that day. So I also teach yoga for pregnancy. I teach the other spectrum also, and I teach, I have taught yoga for kids, and Yoga Nashit really is coming with the approach that, what does your body need? What is the intention that you want to achieve today, and how can we do that through using yoga tools and techniques? But there is also an added element of really tapping into your authentic voice, listening to what your body needs, where your body is. And we have extra tools and extra things that we help to do that, including meaningful text that we really try to use that to help bring out certain things that we think are important. Specifically, Yoga Nashit for menopause, we use yoga to help navigate menopause symptoms. So if, let's say, you are experiencing foggy brain or things like that, we actually want to do poses that help encourage brain function. Cross-body brain, I talked about this with Rena, and she was quite blown away by this. Cross-body poses, so left arm, right leg, for example, or anything cross-body that gets both sides of the brain working, are great poses, great yoga practice for, you know, if you've got foggy brain or you're not feeling, you can't concentrate. So that's just one example, but Yoga Nashit is very much about using yoga as a tool to help you navigate and really tap in to what you need today. And that's why it's definitely adaptable and appropriate for women at all ages and stages of life.
Great. Okay, Toby wrote something that I'll address when I talk, but there's one more thing here from Devora P. Maybe Jacqueline. What about someone who had estrogen, breast cancer? Does she still need to add estrogen? Okay,
so as I have said, as Rena said, we are not doctors and we're not clinically trained. However, I am very educated in women's health and specifically menopause and specifically hormones. There are different ways to add estrogen. If you are in a high-risk cancer category, you need to think more carefully about how to navigate your symptoms if you are experiencing menopause symptoms. Things that may be acceptable or okay for other women may not be appropriate for you. I don't know whether you say you still need estrogen. I think you need to be you have more estrogen sensitivity, and therefore we need to figure out what can we do to help you navigate. And there may be other things, which is why I like the holistic approach, because we may be able to tweak nutrition and we may be able to work on stress that help you to reduce and balance your hormones without having to take extra hormone supplements. So it's very possible that if you are estrogen sensitive, if you have a cancer risk, through the holistic approach of looking at the 7 areas, including the Yoga Nashit, we may be able to help you navigate your menopause symptoms without even touching any type of hormonal additions or supplements. So yes.
Okay,
I hope that answers your question.
Thank you, Jacqueline. Wow, you know a lot, Jacqueline. It's really fun.
Thank you. I hope so.
Okay, so I'm going to introduce myself. I see a lot of people on here that I know and that know me, but there are some new people, so I'm going to quickly introduce myself. My name is Rena Yudkowsky. I'm a geriatric social worker and memory coach. I teach memory improvement courses, which I have now just put online, which is very exciting for me. I was teaching live all around Israel, but now my course is online, and I'm teaching the full course, which is a 12-week course all about memory, the techniques, how memory works, the lifestyle factors, and that's a 12-week course, and it includes a memory assessment, an individual memory assessment. In addition to that, I just did last week a 2-part masterclass on names. Most people come to memory courses because they want to know how to remember names. So I did a 2-part masterclass last week on that, and it was very successful. I hope to run that again soon. So I have worked with seniors in a lot of different venues. Back in America 20 years ago, I was the head of an Alzheimer's unit. I then came to Israel and was very interested in memory and how memory works and why memory doesn't work when it doesn't. And I studied it. I did a course in Hebrew from a cognitive psychologist. I read a lot, researched a lot, listened to webinars, talked to doctors. And I'm also the memory coach for an anti-aging clinic that is based here in Ramat Beit Shemesh. So those of you joining me all know Dr. Barry Dinner. He's an anti-aging specialist and functional medicine doctor, and I am his memory coach as well. So that is a little bit about me. I want to start by answering Toby. Toby put a comment in there saying that a lot of us on here are past the menopause stage, and now what? Like, what's next? So in one sentence, Toby, even though I could talk to you hours about this, what's next is figuring out how to age gracefully, how to age in the way that you want to age, how to age healthfully and happily and wholesomely. And there are a lot of ways to do that. It starts with what Jacqueline was saying, the menopause journey, and looking at that as a holistic thing, and then looking at the whole aging process as a holistic thing. In today's day and age, 50 and 60 is not 80 and 90 anymore, right? Like 50 and 60, like they say 60 is the new 40. People in their 60s are very young and active, and retirement for some people is like the beginning of time to have fun, right? You get to do the things that you never got to do before when you were working or raising children. So the second half of life is exciting. You can get to do the things the hobbies you never had time for. Like I have a list of things on my back burner waiting for me to have time to get to, and it's probably not going to happen until I retire, and I don't know when that will be. So it's about, and I'm going to just give you the pillars. The pillars of what's next, Toby, and everyone, is staying socially active, which is a challenge in these days and ages. We can talk about that another time. Staying cognitively stimulated, which webinars like this help us do, and we'll talk more, and I have a lot of tools for staying cognitively fit. Socially fit, so it's social stimulation, cognitive stimulation, physical stimulation. Exercise is pretty much the best thing you can do for your brain at any given moment. Now that's true of your body as well, but we all know that. So what I'm gonna, and many of you do know how important it is to your mood, health, hormones, and everything, exercise, but to your brain as well. So when you're feeling brain fog and memory loss, you need to get moving in whatever way, shape, or form you can. You need to get moving. Just very quickly, when you exercise, it releases BDNF. It produces BDNF. BDNF is a protein in your brain-derived neurotrophic factor. It is what creates new brain cells and repairs damaged cells. So you want BDNF, you want to be exercising. The things that lower BDNF are stress, which is not surprising, sugar. So when we look at the holistic part of aging, we are talking about all these different factors. The social piece is huge, the cognitive stimulation, the physical stimulation, and the diet part, the nutrition piece. I want to tell you a story. I wrote this in an email that went out yesterday. I'm just not sure if all of you got this email or not. An amazing story that I heard from a Dr. Pam Smith. Dr. Pam Smith is a anti-aging functional medicine doctor. She's one of the top. She trains people. Dr. Dinner trained under her. She's a specialist in metabolic syndrome, which has to do with hormones. And she tells this story about her patient, Sally. And when I heard the story, I could not believe it. So first of all, she says that at 94, your brain should be as sharp as 24. And I said, what? How's that possible? How could your brain at 94 be as sharp as 24? And she says that if we do everything right, now again, we believe in hashgacha pratis and divine intervention, but we still can do what we can do to age gracefully, right? So if we do, there's so much that we can do. Here's the empowering part. We used to think years ago, if you had the gene for cancer, diabetes, Alzheimer's, Parkinson's, that you were going to get it. But we don't believe that anymore. Now, genetics is only 1/3 of the picture. That means you have 2/3 of this picture. 2/3 you can control through lifestyle factors. So in terms of aging, there is so much you can do to age more gracefully. You are not about your genes. Your genes are only one piece of this. There's a lot more to say about that, but I won't go into that. So Dr. Smith tells a story about her patient, Sally. Sally was 67 years old, and she had an appointment with Dr. Smith. And Sally came 4 hours late to her appointment. She lives a few blocks away, and she couldn't find the office. She spent hours driving around trying to find Dr. Smith's office. She lived a few blocks away. She was 67 years old. Dr. Smith looked at a lot of different factors, did a comprehensive workup. Now, most other doctors would have said, dementia, go home. I'll give you some medicine that's not going to work. Go home and you have dementia. Because what do you do with a 67-year-old who can't find your office and spends 4 hours looking for the office? And you live a few blocks away. What else could it be? But no, Dr. Smith is highly trained. She's one of the specialists in America in this field. She looked at grief. Sally had lost her husband. Stress and grief really affect her cognition. She looked at hormones. Guess what? Her hormones were not in balance. Not the progesterone, not the estrogen, not the pregnenolone. I want to mention this is a hormone that I don't think a lot of people know about. Maybe you guys know about it. I didn't know about it. It's called pregnenolone, and it's the memory hormone, and it's also related to stress. And when our pregnenolone is low, our memories are going to be affected. So if you're suffering from memory loss, you want to ask your doctor to check your pregnenolone. And you're going to ask me to spell that, and I think I can actually. I can even write it in the chat if you want. Pregnenolone. I feel like people don't know about it. Now, don't just go supplement it. Even though it's cheap and easy to supplement, we don't want to be taking things that we don't need. So you want to take a blood test. I think it's a blood test for that. And you want to ask your doctor. Now, your regular doctor might not know about this. You might need to go to a special doctor who does metabolic syndrome and functional medicine. But what's important is that there's something out there called pregnenolone that is often overlooked. And if it is low in your body, which as we age, it gets lower. And if you're suffering with memory loss, this is an easy thing to check and an easy thing to supplement.
There's signs all over the street.
Wait, let me just type that into the, I'm going to type that into the chat so you can see what this is. It's pregnenolone. I think, 1 second. I'm going to double check the spelling on that. It's Pregne. 1 second. This is a very hard one to spell. Pregnenolone. Yeah, that's it. Okay. So again, you want to ask your doctor about it. You don't want to just go take anything that you don't need, but it's something that you can check, and then that might help. Anyway, so back to Sally. So they looked at her hormones. They looked at her thyroid. They looked at, she was not exercising. Nutritional, she was nutritionally deficient. When our brains are nutritionally deficient, we are going to have brain fog. We are going to have memory lapses. We are going to have more senior moments. So Dr. Smith looked at all these factors, and guess what happened? She slowly addressed them, not all at once because it's too overwhelming. She slowly addressed these different factors for Sally. And guess what? In less than a year, Sally opened a restaurant. Okay, she went from not being able to find the doctor's office to opening a restaurant, a 5-star restaurant with her son. And now she's 80 years old. At 80, she's still working in that restaurant, and she is thinking about opening a second restaurant at 80. Okay, this is an amazing story because this tells us we don't have to just take certain diagnoses sitting down, right? And that we can question the diagnoses. And even if we're suffering with serious memory loss, even if we're talking about serious memory loss, we want to do everything possible to look at the hormones related to it, to look at all the different factors that I just mentioned, the grief, stress plays a real number on our brains, folks. And this is where yoga comes in, right, Jacqueline? Yoga really can help with stress. I've seen it, I know it, I've heard it from people, I've heard it from young people, I've heard it from older people. Yoga is a huge stress buster. So we really want to be practicing yoga for our brains. It's good for the body, we know that, but it's really good for the brain, like you said before. So Sally's doing great at the age of 80 because a doctor like Dr. Smith was looking at holistic factors, so many different factors. She didn't just do one little test to see, what's going on. She really took a comprehensive look at what was going on. So I find that so hopeful and so empowering because people really can age healthfully and gracefully with the right doctor's help and the right interventions. So I want to go on to talk a little bit about memory because I know there are some people waiting here for some memory tips. Yeah, I think so. Okay, I'm just checking the chat. Okay. So that's a little bit about the connection between the hormones and memory. And there's a huge connection between all the hormones and memory. And what's important to understand is that if we know there's something physiological going on with our hormones, then we could say to ourselves, well, I'm not crazy. When I feel that brain fog or that memory loss, I'm not crazy. There's a physiological reason for what's going on here. And in most cases, I think it's treatable, fixable, or there's something to do for it in most cases, hopefully. That's the important part. Okay, on to memory tips. So my tagline, my business is called Memory Matters. My tagline is, let those senior moments be a distant memory. Let those senior moments be a distant memory. And there's a lot we can do in terms of techniques. So I talked a little bit about the physiology, and I feel there's a lot we can do there, a lot in terms of, you know, the exercise, the health stuff, and I didn't even talk about the risk factors for dementia. That's another talk that we can prevent. But anyway, but now let's talk like practically. Practically, what memory things can we do to help ourselves function better? And the first thing I like to talk about is focus. Some of you here have heard me say this spiel. Sarah and Alice, I know you've heard me say this. Focus. We blame our memories for what's really focused. So I go to the fridge, I open up my fridge and I say, what did I come here for? Has that happened to anyone here? Is that a memory problem? So I maintain it's not. It's a focus problem. Because from when you had the thought, I need the milk from the fridge, till you got to your fridge, guess what happened? Your mind went in 10, 20, 30 other directions. So you get to the fridge and now you were distracted by those thoughts. So what am I here for? I need to go back in my brain to where I encoded or had that thought, right? So it's focus. So let's just talk. And focus is also something through the menopause journey, right, Jacqueline? People have a hard time with focus. They get very, shall we say, scatterbrained or very hard to focus. And I'm going to give you, there's a lot to talk about focus. I actually have 4 techniques, but we're not going to have time to do all 4. I'm just going to give you a few pieces of this, and this will be helpful to you. So number 1 is, we often have this monkey mind. The monkey mind is like a monkey swinging around from tree to tree. So the monkey mind is our brain is jumping, right? It's jumping from this thought to this thought to this thought to this thought, and we can't focus on what we're doing. And oftentimes, our monkey mind jumps to negative thoughts, and that does not make us feel very good. That lowers our mood, lowers our immune system, bad place. We don't want our monkey mind doing that. So how do we focus? So part of that is quieting the mind. And again, yoga is a huge boon for quieting the mind. This is why yoga is so powerful for the mind. So
Rena, I'm gonna interrupt you just for a second and say it's not even yoga, because I know that some people will say, well, I don't have time for yoga, or I've never done yoga. Even deep breathing.
Yes.
Let's just start with breathing properly and deep breathing.
Thank you. That is the first technique. When people say, oh, I can't recall something, and they get all tense. The very first thing you do is take a couple deep breaths, because your brain needs oxygen. So when you're trying to recall something and you get all tense and you start saying negative things to yourself, we want to change that self-talk. So you want to take a couple deep breaths, get oxygen to the brain, and change the self-talk. Instead of I'm going crazy, I'm getting dementia, or I'm losing it, it sounds like this. I know the techniques to help calm myself down. I will use one of the techniques that I've learned from Rena to help my memory. And I can do this. I can do it. I can believe in my memory, and it will come back to me soon. That is a very different self-talk than I'm losing it, I'm crazy, I'm nuts, I can't do this. If we can just change that self-talk, it's so powerful what we say to ourselves. So deep breathing is a really great technique for bringing back some of those memories, for recall. So the monkey mind, we want to calm that monkey mind. So here's a great technique, simple technique to help us focus and calm the monkey mind. It's asking ourselves questions, saying to ourselves, take a moment and you're going to stop and breathe, and you're going to say, what do I need right now? Do I need a drink? Do I need just a little peace and quiet? Do I need to focus on one task at a time, which is the next thing I'm going to talk about, multitasking? What do I need right now? And just ask yourself that question. Take a deep breath. You could, if you're somewhere safe where it's to close your eyes, and just bring your attention to your breathing. It's going to help focus your mind on what you want. Instead of your mind jumping all over the place, you're bringing it back to center. You're centering yourself. And this is what helps us feel calmer and stay focused on what we're trying to remember. You can even ask yourself, what am I grateful for? What does my breathing feel like? How do I feel right now? Sometimes just doing that brings us so much serenity, calm, and focus. So that's the first technique. The second technique is multitasking. we are going to stop multitasking. And this is actually relevant for any age, but I think when we're talking about the menopause and the 45 to 55, I think we tend to we have a lot of responsibilities. A lot of us still have kids at home. We might be taking care of parents, aging parents. So I'm going to go to that age just for a minute. I know we have older people on here as well, but let's go back to that age for a minute. We are multitasking way too much. And then we want to know why our brains aren't working. But we're overstressing them. That's why. My motto is we want to train the brain, but not strain the brain. So when we talk about memory training and memory, making our memory stronger, we want to train the brain, but not strain it. And when we multitask, now multitasking, I think you all know what it is, but it's trying to do a million things at once, not focusing on one task, feeling pulled in different directions. It's really bad for our brain. Now, we have to reprogram ourselves, because most of us grew up thinking that if I could do 5 things at once, I am super productive and capable, right? But it's not true. Multitasking trips up our brain. We make double the amount of mistakes. Just think, here's the example I always use. When you are driving a car while talking on a cell phone, it is the equivalent of driving while drunk. Now that is multitasking. That is the equivalent of driving while drunk. Here in Israel, there's a 1,000 shekel fine and 8 points on your license because it is so dangerous. And in our homes, we try to do so many things at once and expect to be able to do all that at once and feel sane. It's impossible. So we need to, as much as possible, and there are times in our lives where we can stop multitasking, but there are times in our lives where many times, we're trying to do less at the same time. And we will find that we are more productive, not less productive. You're going to say to me, Rena, but I'm so busy, I can't stop. If you can stop, and you can, stop doing so many things at once, you will end up being more productive, not less productive. Now, if you're older and you're on here and you're still multitasking and you're feeling stressed out, well, stop multitasking. As we get older, what happens is it is more difficult to pay attention to more than one thing at a time. When we're younger, we could quote unquote get away with it. When we get older, it becomes more difficult. So you know what? Stop doing it. You'll feel less stressed. You'll feel more focused. Again, there are times in our lives where we have no choice, but whenever possible, do one task at a time. This sounds so simple, but it's actually not. People are on their phone while they're making their cakes, and then they say, oops, did I put in the salt? Oops, did I put in the sugar? Stop multitasking, and you'll remember whether you put in the salt and sugar. We all like to talk on the phone while we're doing other things. Now, there are some things that we can do. We can usually wash dishes and talk on the phone. But if you're making a recipe, again, depending on how good your attention span is, and there are differences and there are individualizations here, but in general, if you're having a hard time with it, stop multitasking. It will help you. It will really help you focus, and you'll see all of a sudden your memory is going to get better, not because it got better, but because you're not trying to do so many things at once, and it's an unrealistic expectation of our brains. Now, our brains are limitless. Our brains have incredible capacity. So I'm not talking about that. I'm talking about not to stress our brains in a way that we feel like we're just all over the place. So it's by focusing it, by not trying to do so many things at once. I want to give one more very practical tip, and then I'll take questions. The next practical tip, and again, I'm giving you the tip of the iceberg. I really in my course, I spend a lot of time on developing all these ideas, but I'm just throwing out a couple different ideas. Another thing that people really find is helpful, and it's called using your senses. Our senses, seeing, hearing, tasting, touching, and smelling, help us encode the memory better. So when I say encode, I'm talking about getting from short-term memory to long-term memory, so you can then recall it. When we use our senses to encode a memory, we have a much higher chance of remembering it. So it looks like this. Have any of you had the situation where you can't remember if you locked your door or if you turned off your stove? It happens to a lot of people, right? So because we're not paying attention to what we're doing when we lock our door. But if you use your senses, it makes you pay attention and then you remember it. So it looks like this. When I lock my door, instead of thinking about 100 other things, I'm now going to look at my hand. I'm going to feel the key in my hand. When I put it in the lock, I'm going to hear the click. And I'm going to say out loud, I am now locking my door. What does that do? An hour later when I go, oy vey, did I lock my door? Yes, I heard myself say out loud, I am now locking the door. It's so simple and it really works. You can ask some of the ladies on here that are doing my course. It really works. I do this all the time. We can even use this for benching and making brachos. when you do it out loud, you have a much higher chance of remembering that you did it because you're hearing yourself. You're using more senses to encode the memory. So you're much more likely to remember it. So the 3 tips that I talked about were to focus, quiet our mind, ask yourself those questions, and deep breathing. That's all one thing. Number 2 is stop multitasking. And number 3 is use your senses. Of course, we can use our senses in many, many different examples. Turning off the stove, taking your medicine to remember an appointment. Again, in my course, I go through every example on how to use your senses to help you with this. I want to offer anyone who's interested a 15-minute discovery call, which means that you can just get on the phone with me and ask me questions, see if I can help you if you're having memory issues. You can hear more about my courses. You can check out my website. For those of you that are not familiar, it's renayudkowsky.com. It's on the bottom of the emails you got from me. You can check out my website to see more about what I do. I have some videos on there that I posted on Facebook. I also have a Facebook group, and I'm happy to share all that information with you. So when we send out the replay, Jacqueline, maybe we'll send them some more information, how they can book calls with us. We'll put links to how they can book calls with us and get in touch with us further.
So before we end, I'll let everyone know how they can reach me. But Rena, some of the things you've said have really, really hit me quite hard. I love your piece of advice about using senses to create memory. I'm going to now start saying I've locked the door every time I leave my house. I just love that idea. That's such a practical tip. That's really fantastic.
It works. It really works. I do it all the time. I talk to myself a lot.
Does anyone have questions for Rena? If they have questions or if they want to ask anything. Rena, I'm going to ask you a question that I think relates to something that we both did. And if anyone else has questions, you can put it in the chat at the moment. The body-mind connection. Because I know that in yoga and in women's health in general, there is such a strong relationship between the physical, the emotional, the body, mind. In Hebrew, we call it, I love the phrase in Hebrew, we call it guf nefesh, which is, nefesh is not really mind, it's something much more deeper, but in English, we call it body-mind connection. Do you have anything sort of to say about that, about memory and sort of that body-mind connection?
Absolutely, absolutely. Oh gosh, there's so much to say.
Maybe put it in the context of menopause and aging.
Okay. So yes, we are whole beings, right? We're whole beings. And it's not just about the level of your estrogen. It's not just about grief. It's not just about, it's bringing it all together. And our emotional piece, you know, we're us women, we're very emotional people, many of us, right? And we are deep and we have a lot going on. And most of us have a lot of goals and ambitions and purpose in life. And we want to continue that way for a long time. But what it takes is, I think it takes paying attention to all those pieces of ours as one, as a whole, which means we need to focus on our brain health. We need to focus on our physical health. We need to focus on our emotional health. And they're all related. You know, when we're feeling depressed, let's take depression for a second. Now, depression is a huge factor, a huge risk factor for dementia, by the way. So let's talk about depression. There could be so many factors that go into why we might be feeling depressed. It could be hormonal. It could be grief. It could be, oh gosh, so many. It could be circumstantial. Like, look what's going on in the world. So many people are feeling depressed now. There's so many reasons why we might be feeling depressed. Depression is a huge topic. But what's important to understand is that depression is treatable. It is treatable. It's treatable, and then it's treatable on many different levels. It's treatable through working on our emotions, therapy. It's treatable through antidepressants, which is a medical intervention. It's treatable through things like CBD oil helps depression. It's treatable from a spiritual connotation. Let's say emunah, when we talk about faith. I mean, when I start to feel depressed, the first thing I do is turn to God, praying, spirituality, faith. I mean, I think a lot of us do that. So there's so many components, and we're one holistic being with so many ways to heal ourselves.
Yeah, Yeah.
Does that answer the question?
Yes, definitely. And that also comes from, you know, my approach also, and the yoga approach.
Yeah. Let's look
Okay,
at the chat. We're getting some
yeah.
information
So
here.
someone's asked about progesterone. Is that Are you asking what progesterone is or progesterone? It is, progesterone is one of the key hormones that women have, if that's what you're asking. With respect to breast cancer, it very much depends on what type of breast cancer you had. And I advise every single woman to go and get a very good hormonal blood work done. You need to ask for it specifically from your doctor, especially if you're along your menopause journey. Even in postmenopause, you want to, if you're still experiencing a lot of health impacts, you want to check out where your hormones are. You need to have 2 blood tests done. 1 is not enough. You need to have it done a little bit spaced, but progesterone is one of the essential women hormones that help us with our natural cycles, if that's what you were asking. I think there's a question there for you, Rena.
Oh, thank you. I'm going back up about food. Someone asked, is there any food that has natural pregnenolone? That's a good question. I personally am not sure, but someone answered. Avocados, coconut oil, olive oil, walnuts, fish, chia seeds, flax seeds is a healthy fat. All of these things are very good for your brain. I don't know if they have pregnenolone in them, but I'm assuming the person who answered knows that. And it says, I'm not even sure, it's M. Tova. I'm not sure who that is. But that's a good question. I'm not 100% sure, but those foods are all very good for your brain. These are great foods, and the seeds also have phytoestrogens.
Yeah, I said that, yeah.
Okay, Jacqueline answered that. Thank you. You answered the next question. Any tips for helping to remember what we learned in Shiurim? So someone answered, take notes as you listen. How often do you need the blood hormones checked? Okay, let me just answer about how to help with what you learned in Shiurim, and you could answer about the blood hormone check. In terms of remembering large amounts of information, so first of all, focusing. If you are doing something else while listening to a class, you're not focused on it. Now, some people can get away with, like I said, doing more than one thing at a time, but you're not going to remember all the details of that class if you're doing something else. So first of all, paying attention. Second of all, taking notes is great. And third of all, I do talk in my class about how to remember large amounts of information. I usually talk, I'll just give you the main points. It's outlines. You could use either written outlines or pictorial outlines. If you're good at imagining pictures, which is something I practice in my course, visualization, you can make a pictorial outline. Let's say it's Shabbos and you can't write down the shiur that you're listening to. Then you can make a pictorial outline in your mind. And I go through how to do that in my course, but I'm just throwing it out there for you. You guys can be in touch with me for more information about that. Okay, Jacqueline, do you want to answer that about how often to do the blood?
Yeah, so blood hormone checks are really, really interesting. I actually have, which I'm happy to share with anyone who would like, I have a doctor's appointment checklist. If you're going to see your doctor for the first time or during your menopause journey, what type of things you need to be asking for? Because as I mentioned, I'm not doctor bashing, just many doctors are not trained in menopause management and how to sort of navigate this time. So really, specifically for hormone checks, you need to have 2 blood tests, because menopause by definition is hormonal fluctuation. So a one-time blood test will not show you where your hormones are, because it depends on what day you're having that test. So you need to really have 2 about 6 weeks apart. You definitely want one of those hormone tests to be around your period, 2nd, 3rd day of your period. If you have already finished your menstruation cycle and you're in postmenopause, and you're, you know, a few years later, then you definitely want to go and have hormone checks. And I would still advise having them done twice, but they don't necessarily need to be around your menstrual cycle. Hormonal blood checks is super, super important. And you want to really ask your doctor for as wide a range of hormone testing as you can get, because the more information you have, the more you can help you uncover what is going on if you are not feeling your best. So that would include estrogen, progesterone, testosterone, insulin, cortisol, thyroid. There is another one which I'm going to check out what its name is.
DHEA? Did you mention DHEA?
Yeah, DHEA. Yeah. Those all need to be checked, and they need to be checked if you feel that The reason why I would recommend a woman to go and have hormone testing is because she just doesn't feel right. And all the other medical tests that her doctor has sent her for have come back clear. So she thinks, but just something doesn't feel right in her body. She's still suffering with aches and pains, or she's still suffering with certain experiences, and she just doesn't feel right. I would definitely go and get, yes, and I can see someone's asked me to write down the names of the hormones, and I will put them in the chat now. When you just don't feel right and every other test has come back clear, then you really want to go and dig further.
You know, Jacqueline, it always strikes me how our bodies are such an amazing harmony of so many things in balance, right? And even one thing out of balance makes us not feel good. But
yeah,
how much more so when a lot of things are out of balance? And we're complicated human beings.
We definitely are. And I know that a lot of women struggle with weight issues during menopause, and there are a lot of nutritionists that are helpful during this time, and I think that is amazing and fantastic, and nutrition is definitely one aspect that I deal with. But I always like to say that if you go see a nutritionist and you get your food all in order and you're eating the right things for your body, and you know there's all different ways that a nutritionist can help you, but you are super stressed out and you are leading a really, really stressful life, it doesn't matter what you're going to be eating, your cortisol levels are going to be high, and it will just continually throw everything out of whack. Which is why I think that both of us agree this holistic approach. I have, you know, my holistic seven steps of health and well-being assessment, and you do, you know, you have the things that you look at when you're looking at brain and memory function. Looking at one thing is just not cutting it today. You've got to look at how everything is interacting and the interplay between all the different elements, especially at this stage of our lives.
Yes, 100%. And there's one big factor we didn't talk about because it's hard to talk about everything in this amount of time, but sleep. Sleep,
yes.
And you think cortisol and sleep and adrenals are, sleep and thyroid, sleep is, and brain. Sleep is huge. I always say sleep is the secret free cure to most diseases. Your brain is going to function so much better if you sleep 7 to 8 hours a night. Now, I know all the older people tell me they can't sleep 7 to 8 hours a night for all their different reasons. But I want to just say, we could actually do a whole webinar on sleep. I just want to say that if you're not sleeping well and you're having memory issues, that is like #1 thing to look at and talk and figure out what can you do to get better sleep, because it is absolutely affecting your memory.
Okay, so as we're coming towards the end, Rena, I'd love to invite everyone to put in the chat box maybe something that they've learned today, or a takeaway that they can take with them, something that you didn't know before, something that, you know, you can really, a takeaway, you know, a takeaway that you can take with you, so that the information that we've learned today doesn't just stay here in our little webinar, but something that you can actually take with you today that you've learned that can help you. So maybe if everyone wants to comment in the chat box, if they want to put, you know, your takeaway from today's webinar, we'll give you a couple of minutes just to write.
And thank you, Lee. Lee wrote, Jacqueline and Rena, thank you both so much. Fantastic, full of good information. Can we have more Zoom lessons? You made my day. Loved every minute. Oh, I'm so happy we can make your day, Lee.
If it was that easy, we should do it every day.
Yes. You definitely can connect with us to get more from each of us. And maybe we can do another one in the near future. Yeah. I think there's a lot more information. There's so much to say about this topic. This is just like the beginning, you know?
Yeah. Let me just, while people are writing in the chat box, although I know you told that we shouldn't multitask,
yeah.
Let me just tell you that
I can't run a Zoom meeting without multitasking.
I know. How you can reach me. I've made it very simple for everyone. I am at the Yoga Room 120. So I'm at theyogaroom120.com. That's my website. Facebook, it's facebook.com/theyogaroom120. You can email me at theyogaroom120. I am at theyogaroom120 everywhere. Instagram also, though I am much more active on Facebook. But I'll be sending you all out an email so that you can reach me. You can reply to my email and you'll be able to get me. But if you want to reach me before then, the Yoga Room 120 is the place to get me. Okay, we've got...
Deborah wrote a comment that I get a lot. I want to answer this. Deborah wrote, is talking to ourselves helpful, not like crazy people talking to themselves? So whenever I say that example, say things out loud, people always say, but everyone's going to think I'm talking to myself and I'm crazy. And I always tell people, first of all, who cares? If you're going to remember whether you lock the door, who cares what anyone else is saying? And second of all, you know, these days, everyone's walking down the street with Bluetooths in their ears. So everyone's talking to themselves anyway. So it's not really an issue anymore.
Yeah, right. Toby said, feel good about yourself. You are in control of your life. Toby, that is your takeaway. Yes. That is the best thing ever.
Amazing. Amazing.
Yeah.
Okay, good. I see a lot of good takeaways here. Thank you everyone for commenting. And I'm glad that this was helpful.
Yeah.
We have
it's
a lot
been so great to have you all
here. We have a lot of you.
Thank you.
Okay. Everyone
great, ladies. Thank you.
Night, whatever time it is, wherever you are.
And of course, Rena and I are available if you want to reach out to us, if you want more information. We both had some free session times for you, so we're here fit to support you.
Yes. I want to say, with the mask on, nobody knows I'm really singing as I walk. That's great, Sarah.
Yeah,
that's great. And should we talk to ourselves to help memory? Yes. You should talk to yourselves in two ways. One, we said, is the self-talk. You should have positive self-talk when you're having memory issues. It's no longer, I can't do this, but I can, and I will. And the other way we're self-talk, talking to ourselves is like I said, with the senses. I now turned off the stove. I now said that bracha achrona. I now made the appointment that I needed to make, so that you know that it's done. So yes, those are two ways that you can be talking to yourself.
Yeah. I love that. I talk to myself anyway, but now I'm going to be doing it as a memory group also. Yeah. Okay. Amazing.
Okay. Thank you everyone for your engagement and for being here with us. We appreciate it. And this has been a lot of fun. And it's fun to see all of you that have your cameras on, the ones that I can see. And thank you all for joining us. Have a good day. And everyone should be healthy and
well.